My name is Beth Freeman, and I am the Career Readiness Coordinator for the Kearney School District. I will be helping move the conversation along today and try to help with getting questions answered if there are some. I'm also a member of the Northland Education and Business Alliance, also known as NEBA. NEBA is a network of education and business organizations in Clay and Platte counties whose vision is to promote and provide business-driven educational opportunities for you, our next generation of business leaders. I will be your host, but we have two other NEBA members working in the background. We've got Natalie Barner from Park Hill School District and Amy Washam from Northwest Missouri State University. So they will be helping move this along as well. Just a few quick notes before we introduce our guest speakers. We have two during this session. This session will run for 40 minutes. We will have to stop the session right at 8:40 to move on to the next ones that are planned for the day. Our industry experts will begin by sharing their professional history and insight, but we want this to feel more like a conversation. So you will see a Q&A box in the bottom of your screen, and you're welcome to submit questions that you have for either of our panelists. We might not be able to get to them all, but we will definitely make a point to try. At the end of this session, you will be asked to take a short survey. Please give us feedback on the event so that we can get better at hosting things like this in the future. This is the first time we've done this virtually, so hopefully it runs smoothly and we can do it again in the future. Last but not least, this session will be recorded and available online very soon. Okay, let's get started. I would like to go ahead and introduce our first panelists. Well, I'll introduce both panelists and then we'll start with one. We've got Jana Longwith, and she is from North Kansas City Hospital, and we've got Joe Micek from Liberty Hospital. So Jana, we'll go ahead and we will start with you if you want to give us an introduction and tell us about your life within your industry.
Certainly, I'm happy to. I am the Director of Community Health and Wellness for North Kansas City Hospital. I've been here 20 years. It's kind of an unusual position and one that most hospitals and healthcare systems don't have. It's certainly not at this level, so I'm very fortunate to have had that opportunity. I started out in community and economic development. I was certified as a chamber director, as a economic development finance specialist. My degree is in business management and economics, and I worked for economic development agencies and chambers, and that's what I did. One of our board members on the Platte County Economic Development Council, where I was working, actually asked me if I would be interested in a new position here at the hospital because they had just built this pavilion that had a lot more space, and they wanted to bring the community into the facility for more than just treatment. They wanted to be, because we are a community hospital, they wanted engagement from the community. So she asked me if I would be interested in the position. At the time, they had one event and 7 classes a year. So I thought, wow, that'll be a very easy job. And I needed the stability and the benefits that come with healthcare. I will say that all of you take notes on that. Stability and benefits come with a job in healthcare. That's a really good plus. And that was a plus for me. So I started, and I don't know quite what I was thinking, but somehow in the next few years, we ended up with 315 classes, 11,000 participants, and about 300 events a year. So we changed things up a little bit. We have a staff of 7 and 32 contractors. What we tried to do is use the assets that the hospital has, like the pool and the fitness center and physical therapists and occupational therapists and diabetes counselors and all of those things, to bring those out into the community and to teach the community and to help them with their wellness. So we have a lot of classes in our wellness pool. We have a warm water pool that we have 6 classes in a day for people with arthritis. We have what I think is one of the most interesting things and impactful things we've ever done. We took a yoga studio, actually it was an old aerobic studio, and turned it into a rock steady boxing facility. What we discovered through a physician is that Parkinson's patients, the only thing that slows the progression of Parkinson's other than drug therapy is boxing. So we have 11 classes a day now, or 11 classes total, I'm sorry, for people that have Parkinson's. And if you ever want to feel good about a job, you just have to watch those folks come in a wheelchair and then stand up and box for the next hour, and they feel better. The first thing they learn is how to fall properly. They build their musculature and their coordination. It's an amazing program to watch, and that's what I get to do here and what I'm probably most proud of. We have a monthly lunch and learn for physicians where now it's on Zoom, but we used to provide lunch and a physician would come in and talk about something like cholesterol, or our next one is actually how to do a virtual doctor's visit. We try to do something that the public is interested in, and it's free of charge. And we usually have about 100 people that participate in each of those. Right now we're running 4 or 5 virtual classes a week, which has been new to us and hard for someone my age to adapt to, but that's what we're doing. And we're getting some very good traction for that. So I think part of what I've enjoyed the most about this career path is the opportunity to grow something that helps the community, to use some of the skills I already had to work to help people, even though I'm not a clinician. And they don't let me touch any of the clinical parts, but they do help allow me to build programs that help the community. So in a nutshell, that's who I am and what I do.
Thank you so much for sharing. Sounds like you do have a lot to be excited about there, a lot to be proud of. I would like to move on to our next panelist, Joe Micek. If you would like to introduce yourself and give us some background on your industry.
Yes, I would. My name is Joe Maisic, and I'm an infection preventionist. So right now is my Super Bowl. I didn't get into infection prevention. I didn't intend to get into infection prevention. I became a nurse first and did bedside nursing for about 12 years and absolutely loved it. I love the patient interaction. But what I would say to you is be open to opportunity. My whole career path has been being open to opportunity and being willing to stretch myself and to look at different things. I had a colleague come up to me and say to me, I think you'd really like this job. And it was a nursing job, but it was an alternate nursing job is what they used to call it, where you went outside of the bedside role. In my role as an infection preventionist, I take care of not only the patient, because what we want to do is prevent infections in the patients, but we also want to prevent infections in our staff and prevent our visitors from getting infections. And so it's a much more global look, where before I worked at a bedside and I focused on one unit most of the time. Now in this role, I go all over the hospital. I work with housekeeping. I give board reports. I also work and interact with the physicians on projects. And what I'm trying to do in my role is look at evidence-based practice, look at what we do, how can we improve, how can we be the best at preventing infections. So that's a lot of what I do. Now, as I've gone through my role, I've worked at 4 different hospitals. I actually am a 20-year at Liberty Hospital too, so been here that long. And I also work as a consultant and have worked in clinics. I've gone and looked at product development and actually had a wonderful opportunity several years ago to go and teach in China. And that's why I'd really say to you, when people ask you, can you do things? They asked me to write a white paper. I'd never written a white paper. Didn't mean I couldn't, but I needed to learn how and push myself, and I did. And that opened up and gave me an opportunity to be able to go to China and teach. So it is really important, no matter what you decide to do, to don't limit yourself, because you just don't know what is going to come in your direction.
Thank you so much. I think we are going to go ahead and start answering some questions from the crowd. Those of you who are watching, don't forget there is a Q&A box where you can type in your questions, and we will do our very best to get to all of them. Natalie, do you want to start with one that you see?
Yes. For both of you, what is the level of education you have or needed to get to the position you're in today?
I have a bachelor's degree in business management and economics. I have several certifications, and this close to a master's degree I didn't finish. But the certifications became more important at some point.
Well, I got my diploma through nursing, and I also have gotten my certification. I started doing this long enough ago that I went to CDC and trained there. They don't do that anymore. It was a wonderful opportunity. I don't have my master's either. But what I would say to you is, right now, if I was going into a career path, I would definitely get it. At the time that I went in, there wasn't a master's program in infection prevention, and there were very limited master's programs. But I highly encourage you to go as far as you can, as far as education goes, because it will open up opportunities for you.
And more in healthcare, a master's is required.
Mm-hmm.
To start out or as you continue going?
As you continue going, it's expected.
Thank you. We have a question for Joe specifically. What is your day-to-day life normally at the hospital?
Well, right now,
yeah, it just says normally.
This would be way different than normal.
Yes. March. So, just to give you an example, I come in every day and I look at how many patients we have who are in a form of isolation. I communicate that out because it helps us look at our staffing needs. We have a COVID incident command right now where key players sit down and look at current status of the hospital. We also look to see any challenges. We look 2 to 3 weeks to a month ahead of time to see what do we need to do, how can we meet the needs of our patients, and also meet the needs of their families as well. Recently, we reviewed and looked at our policy and updated our policy on end-of-life visits with COVID patients. This is something that can be a real struggle. This visitor limitation is very, very hard. But one of the things I look at is not only the needs of the patient and the family, but protecting our staff. I also do rounding and I answer questions. And there is no bad question. And what I have found is the questions people ask will make them more comfortable, make them feel safer in doing this hard work that we're doing right now. And so that's part of what I do. I also look at the cleansers we used to clean with. I watch to see if people are washing the hands the way they should. As far as using masks, are we wearing the right mask in the right situation? And are we being compliant with that so we can keep everybody safe? And then I do have meetings and planning, and we also look at every lab culture that comes through the hospital, review that to see if that could possibly be an infection and evaluate that too. So that's kind of my day usually.
Well, thank you. And thank you both for what you do, especially during this hard time. I know it's definitely taxing on everyone. So everyone in the community appreciates both of what you contribute to the community right now. All right, we have a lot of questions in the chat box. So another one for both of you is, have there ever been a time where you wanted to give up in your career or in your profession because it's so difficult? We'll start with Jana.
Okay. Occasionally, but it doesn't last very long. It's varied enough, and there are enough things going all the time that you can always find a way to find something positive in what you're doing, at least in my world. And so maybe possibly for a while, but never for long.
Thank you.
Or I wouldn't be here 20 years.
Right.
Well, I can echo that too. I get frustrated at times, but what is inspiring to me, honestly, is if you take a step back from your angst, is what I'll call it, and look at how hard people are working around you, it makes you want to be part of that solution. So by doing that and understanding that you can help make a difference, it really helps you get through some of those hard times. I also will reach out to colleagues. If I have something, an issue or a concern, or I'm frustrated, I'll reach out to a mentor or reach out to a colleague and discuss it with them. And sometimes just talking about things really helps you work your way through it so you can go on to be more productive and not be frustrated at the time.
And I will say that about healthcare, it's very collaborative. I
Yes.
think that Joe would agree to that. So there's always someone for you to talk with. You're not alone.
Thank you. All right. Another question from a member that is watching. What is the best part about your jobs, and why did you ultimately choose the career you're in?
I chose the career that I'm in because somebody asked me to do it.
Mhm.
And it was interesting and it was stable. And it gave me an opportunity to build something and to grow something. So that's why. And what was the other part of the question?
The best part about your job.
Oh, the best part is the fact that it's not just one thing, it's a lot of things, and you can impact your own community in a good way.
So and we'll let Joe answer this in a second, but Jana, why you just talked about that. If you could do it all again, would you do the same thing? Would you take the same path?
Yes.
Awesome. Thank you. All right, Joe.
Okay, so the best part of my day is actually when we see successes, or the best part of the day is watching somebody go home safe, whether it be a patient or an employee, for them to go home and be safe and have done what they need to do in the day, or to help a patient be discharged and go home to heal. To me, that is the most rewarding thing about my job. Absolutely, hands down. And you'll have to,
No, you're fine.
Yeah.
What made you choose the career you're in?
Well, I was looking for a career in nursing. I went into it because I wanted to take care of people.
Mm-hmm.
Getting into infection prevention, this was supposed to be a 5-year gig for me. I was going to do it so I could have the weekends and holidays off with my kids. Okay. Just going to be really honest with you. And that was 34 years ago. So once I got into it, I loved it. And I've just kept going since then.
Awesome. And would you do it all over again?
Absolutely. Absolutely.
Very good. Another question for both of you. Is it easy to lose motivation while you're at your job and during these hard times?
I think you become more motivated. I mean, there are people that really need help here, and the hospital
Mm-hmm.
needs help. I mean, I've spent days screening people at the door because they were short-staffed in the hospital. Everybody's pitching in. So if anything, I think people are more motivated to help in that. Since I'm community and a lot of our programs we just can't have right now, finding ways to still help the people that need us it's been a good motivation and made us look at things a little differently.
Great.
I totally agree with you. It has been so challenging, but I will say this, the healthcare workers are really good at thinking outside of the box and looking at other ways to do things. I mean, this is a great example of what you're doing. You're taking something and making it virtual so that more people can probably attend this now and watch this. And I think in healthcare, we look at it the same way. A lot of times, some of those things we try to pre-plan. We have emergency preparedness for these kinds of things. But even that, you have to respond nimbly and quickly to some of the things we do. Don't wear a mask, now wear a mask. Please wear a mask. Please wear a mask,
Mm-hmm.
And, but also looking at when we were when you look at our personal protective equipment and some of the challenges we've had with that. We've talked to our staff, and I would say that that is very inspiring because they want to do the right thing. They're open to listen to you, but they do want their questions answered, and then they're full in, and that is truly inspiring and makes you want to work harder and better for them.
Great, thank you. We have another question for both of you. With so many different areas of healthcare, how did you know what to pursue and kind of what branch that interests you? And how do students and people that are just wanting to start out, what would you recommend that they do to figure out what area they're interested in?
I think one great opportunity is with the CAPS program. We have 2 classrooms and 2 sessions in each classroom here at the hospital. And we try to give them a broad look at everything that's available within healthcare. If not CAPS, then that same job shadow, talk to people, try to do something where you're visiting with people in different parts of the hospital, because I know I'm not someone that touches patients, but I know I'm making a difference. So I belong in healthcare. So it's being there and seeing everything that happens. I had no idea when I came here how many different jobs and how many disciplines and how broad the opportunities were here. So I think just explore it.
Thank you.
I agree with everything you said. I love the fact you have a program for students to be able to participate. And I think that what I would encourage them to do is to don't limit yourself. Look at all your options. If you had told, I got a C in micro in college. I mean, really, honestly. And if you had told me I was going to be looking at organisms and cultures and doing the things I'm doing right now when I was your age, I would laugh at you because I wouldn't have thought that at all. But I think you just have to be, again, and I'll keep saying it, open to different experiences, talk to different people who have different jobs, hear what they do. And it can really help you open up and consider lots of different things instead of looking just at one certain thing.
Great, thank you. This is a question from Sydney. We have a lot of students that are in, I think, middle school and high school probably on these calls. And she wanted to know if there are organizations or other opportunities that they could get involved in right now outside of the school classes that we offer.
There would absolutely be, if we were not in the middle of the COVID issue right now. Like we have a volunteer program, a youth volunteer program, and that's a really good way just to learn what the hospital is and work your way through it and do lots of things that open your eyes to what the hospital is. So when we're able to do that again, I would recommend, that's where I always recommend that they start. We also have a job shadow program.
Is there an age for the youth volunteer program?
14.
Okay, thank you.
And then we have the job shadows are really helpful, and we do hundreds of those a year. But right now we're so limited because we don't want to put you in danger.
And that's at Liberty we do. I don't know the ages for our programs. We do have some programs available that they could do. And but again, right now we are limiting, and we don't want people to get exposed or to be in the hospital at this time if it's not necessary. So once this is over, and believe me, it will be over. I promise you it will be over.
I believe you.
We hope so.
And once it's over, then we'll be able to do that as well.
Great, thank you. For both of you, again, is there a patient that you've had within your career that you just can't forget, and why are they so memorable?
I don't take care of patients, but I can tell you 2 community participants that I'll always remember. Both come in wheelchairs. One goes to the warm water, and when she can't walk, we have to put her on the seat to put her in the water. And when she gets in the warm water, she can move, she can walk, and she feels better. And you can see the pain lift from her face. So I try to remember that. I don't have to try. I remember that whenever I need to, whenever I need to feel like we're making a difference. And the others would be the Parkinson's patients. And there's one in particular that comes in a wheelchair and has to be helped up from it. And then, I mean, their studio is next door to my office, and I think they're coming through the wall, hitting those bags. So he's able to do that, and he feels so good about himself. That him in particular, I remember from the program, but there are a lot of them.
Well, I would say there have been so many different stories and patients that I've had experience with, and I've witnessed healthcare workers doing amazing things with them. But one I would share with you, in 2004, when H1N1 was the new novel influenza, and we were stretched, not like we are right now, but we were definitely stretched. We had a mom who came into the hospital, and with H1N1 for a pregnant mother, it really put them at risk. And we delivered the baby by a C-section. Mom had to go on a vent. Mom was in the ICU for an extended period of time. Mom finally got off the vent, fully recovered, and came back in to see the ICU nurses carrying her baby once she was all healed. I won't ever forget that, because there were so many odds against her medically, and to see that, and to see that mom carrying that baby really affected me on what we do as healthcare workers and what a difference we do make every day. And it happens every day. And I don't mean to trivialize, but I do think some of the patients who leave our hospital years ago would never have done that. And I just can't even imagine for you what you're going to experience in healthcare in 10, 15 years. It will be so different and so much better than it is right now.
I think with a focus on wellness, I think prevention and wellness is where things are headed. We actually have 3 wellness corners out in the community so that we have nurses and practitioners meeting with people in the community so that they can take their blood pressure, do their cholesterol, talk to them about exercise, work on their wellness. And we've had so many stories of people that we caught out there with serious health issues that were addressed that we wouldn't have found otherwise.
Mm-hmm.
So I think the direction everything is going, and it may be because of what I do, but I think you're going to see a lot more wellness and prevention happening. I hope so.
I do too. I do too.
Yeah. Thank you. Let's see. We have so many questions. I'm trying to decide which ones to ask. Is there a crazy infection that you have dealt with before? Joe, you have a very cool job. It sounds like the students want to know about a crazy infection.
Okay, so I do have one that I've never seen this I've never seen it in a patient, but when I first got into infection prevention, I was rounding in the micro lab, and they had an organism they could not get to grow. And so one of the microbiologists took and put a little bit of oil on the plate, and then they let it grow. And by the time it had grown, the patient had gone home. So I didn't get to see the patient, but I will never forget the name of this organism. And I've never seen it again in a patient, but it was called Malassezia furfur. And I just thought, that is just really very interesting. And so I think that would be it.
Sounds crazy.
That's to me.
Yeah. And then there's another question about just experience overseas, your experience in China that you had. And Jana, I don't think you mentioned you had been overseas to do any part of nursing. So this is for Joe.
It was a wonderful opportunity. It was a very quick trip. I was there for a week, and I went to 5 hospitals during that time and did Q&As in between with the physicians and nurses. The focus that I was teaching on is how to clean surgical equipment correctly. And there was just a piece in that process that they weren't familiar with. And so that's what I did. I did education on that. It was absolutely a wonderful opportunity. I went to beautiful hospitals in China, very nice hospitals. And what was interesting is, even though we didn't speak the same language and we had an interpreter, I had an escort that went with me to help interpret because I don't speak Chinese. There's some true links in wanting to do the best thing for the patient. And I think that was a good connection through all of it. It was also, there was a lot of curiosity about the United States. And it was just wonderful to see and respect the way China did healthcare and what they did. I have to tell you, I did go to their largest facility in Beijing. And when we went there, we walked into a courtyard, and then there was this plaza, and there were 3 skyscrapers within this plaza. And they did 40,000 surgeries a day.
Oh my God.
40,000 surgeries a day. It was just overwhelming, the pure numbers. And also in China, several things I noticed that I thought was very interesting. One thing is I would go every morning and before my day began and just walk around a park or around the hotel grounds just to get out and focused. And I noticed that there was a lot, everybody walked everywhere. You didn't see people in little carts with baskets. Everybody walked. Now, it may be a little bit of a shuffle walk, but they all walked. And there also was a great deal of respect for the elderly. You could see that wherever you went. And I really appreciated that. One of the things too that I did, I promised myself, I've always used chopsticks. I don't know why, I just like them. And I just think it's fun to even to cook with them. Okay. And so when I went over there, my goal was I was going to use chopsticks for every meal. And I did that. I made sure I used chopsticks for every meal. But before I went, I made sure that I reviewed about the culture. And I also talked to a couple colleagues who traveled in China with business so that when I went there, I wouldn't offend anybody while I was there. And I would be respectful of their cultures and their philosophies as well.
Sounds like a great experience.
It truly was.
Yeah. All right, Jana, one for you specifically. And we might have already talked about this a little bit, but can you clarify how boxing helps people with Parkinson's and what it does for them and for their bodies?
Again, I'm not a clinician, so bear with me. And it was discovered because a boxer got Parkinson's and he started boxing again and the disease slowed down. So when it's become a movement, there are several places now that do it, even in Kansas City, but ours is one of the largest. It's something to do with their balance and their strength and the focus and the movement. It does something for them neurologically. It's the neurologist that actually asked us to start the program.
Works all together. All right, we have
Joe,
about
did I explain that well enough?
Yeah, no, that's good. To me,
Joe's the clinician, she would know.
Yes.
Oh, perfect.
Yes.
Absolutely perfect.
We have about 68 participants that have been on this morning. So from all of us, we want to say thank you. And then there are some more questions that we're not going to be able to get to, but thank you. And I'm going to turn it back over to Beth now.
Okay, thank you all for coming. 68 participants, that's great. We're so excited to share this information with everybody who's here today. We appreciate our panelists. Let me wrap up by saying, I hope the people in the audience enjoyed hearing about one of the thousands of amazing career opportunities here in Kansas City. Please be sure to take a minute or two to complete the survey that will pop up on your screen after this session ends. This will help us ensure that we're bringing you a helpful and relevant content. To find more information on any of the topics today, you can go to the NEBA website. That is www.nebaworkskc.org. Thank you for joining us and have a great day.
Thank you.
Bye.
Thank you for inviting us.
Stay well, everyone.
Yes, thank you.
Bye.